Corla. Minister, this bill is a response to the medicines crisis being faced by Irish patients suffering with a rare disease, and I would also like to compliment Deputy John Brazil on his work in this. The Health Pricing and Supply of Medical Goods Amendment Bill 2018 seeks to reform the HSE's current reimbursement process by establishing for the first time a unique process for assessing an orphan drug for reimbursement in Ireland. The bill, which is being debated tonight at second stage, brings a long overdue and credible solution to the ongoing crisis surrounding access to medicine for patients with rare diseases in Ireland. Orphan drugs refer to medicines which treat, diagnose or prevent diseases that are life-threatening or chronically debilitating and affect fewer than 5 in 10,000 people. Currently, they are assessed under the same guidelines and procedures as standard drugs, despite the clear differences between the two. Rare, high-tech drugs will naturally treat an extremely low patient population. To measure their effectiveness in the same lens, using the same criteria as common conditions, will naturally cause a difficulty. Other EU countries have adapted this process for this very reason, and we believe it is time that we did so now. In the last few years, I became aware of 2 orphan drugs. Firstly, Respreeza, which I heard about in the AV room, where I met a gentleman, Johnny Hannon, who was on a trial for this drug on a compassionate access programme. Respreeza is used for maintenance treatment to slow the progress of emphysema in adults. The effect of this drug on his life was simply a game changer. But that day, Minister, I was struck by another lady in the room who didn't have access to the drug on the compassionate access programme. And every breath she took was an absolute struggle. And I remember speaking to her later and she telling me the basic things like getting up, getting washed, just simply even going into town to do some shopping was a struggle. And I believe it's simply wrong when you are ill and a drug can change your life that you have to take to the streets and fight for this drug. It is not acceptable that citizens suffering from severe illnesses are forced to take to the streets or to go public in the media to have their voices heard. The drug Orkambi is one people are also familiar with, which was a high-profile campaign led by Gillian McNulty, who had the benefit of the drug, which in her own words transformed her life. It is estimated that 60% of the cystic fibrosis population in Ireland have now begun Orkambi treatment, which is very, very welcome. Professor of Medicine at RCSI, Jerry McIlvany, says, in general, the results from Orkambi were better than I expected, and I think it has given significant relief to a significant number of patients. He also said we have a duty and an obligation to ensure that patients with rare diseases receive the same treatment and care as any other patient in Ireland. And Minister, access to drugs like these can result in less time spent in hospital, less acute beds being used, and patients can spend more quality time at home. So there would certainly be a cost there, a cost savings to the state in relation to the amount of time spent in hospital. I believe this bill is both a timely and logical step, and I would welcome, Minister, I would hope to see that you would agree with this bill and that you would work with Deputy Brazil to see it enacted as quickly as possible. You know, because I can't imagine what it must be like for a parent of a child with a rare disease, and all you want to do is to give that child every chance at life. And if you think there's a drug out there that might give your child a fighting chance, well, I think the onus is on us as legislators to make sure that that child gets every chance. Gaurav Mahagut.